Canada is implementing a 3-digit suicide prevention hotline starting next year. The 988 number is expected to launch on November 30th, 2023. Carolyn Bennett is the Minister of Mental Health and Addictions and the Associate Minister of Health. She's in Toronto tonight. Minister Bennett, welcome to the program. I wanted to start by asking you about the 988 hotline that was announced earlier this week. I think that's something a lot of people have been waiting for, and it might be a really powerful lifeline for folks who are struggling. But it won't be implemented until the end of November 2023. Why is it taking so long to get this off the ground?
Well, JP, it's really important that we get it right. And this is a big country, and with the technical challenges with many parts of the country not having a 10-digit number, it's really important that we launch it and leave no one behind. The Americans were able to launch their 988 number this summer in July. It took them over around 4 years to be able to hook it up. But I think that firstly, we want everybody to know that the Talk Suicide number is there at the 1-833-456-4566, and that is answered 24/7 in English and French, and that continues. But while we're trying to get the 988 number ready, it's about capacity across the country and quality. And as we announced, the CAMH is working with all the distress centers across the country to be able to make sure that that capacity is there and that the quality is there, as that it's really important those calls are answered properly.
Yeah, because the House of Commons motion on this issue passed unanimously back in December 2020. You're telling me it really couldn't have been implemented earlier, that it is going to take this long to stand it up because it is more complicated perhaps than some people might have thought when they pitched this idea?
Yes, I mean, there are still parts of Canada that don't have 911. And so it is a matter of making sure that you have the technical ability to make those links, but also that there's people there to answer them with that kind of local knowledge, local wisdom. Last week when we were in the States, in Washington and Oregon and Colorado, it was really clear that the depth that people want. You want someone to call, somewhere to call, a team that can respond if necessary, as well as somewhere to take somebody if they need that help. Lots of the calls, it seems, are able to be helped online and given resources. But it's really important that and it seemed that some of the calls that went to 988 in the States this summer have actually come from 911. It was police themselves making that call. So all of the first responders, all of the frontline providers need to have confidence that if someone dials 988, that they will get the appropriate care.
There has been some growing pains in the U.S. with their 988 number. It seems like one issue is staffing, like you mentioned, that it is difficult to have people in place at all times to answer the phones. How do you ensure that when it launches here in Canada, it has the staff and the resources it needs to really deal with people who are in a vulnerable state?
Well, this is when we made the investments to some of the distress centers at CAMH this year. It was really interesting talking to the people from the distress centers and CAMH that's organizing it in terms of what the training is for volunteers, but also the providers that we see in some of the clinics. But we are, I think, going to spend this time wisely, making sure that these calls are answered and answered appropriately with the good quality. It was interesting also at that time, JP, that they were saying that some of the volunteers on these lines then want to become a social worker or a psychologist, that there is a pipeline that happens when people volunteer for these distress lines. And obviously Kids Help Phone is fantastic. And there are, many other approaches. In 2020, we stood up Wellness Together Canada. And on that platform, there's one of the opening questions is, have you had any thoughts of harming yourself? And it's been, I think, really, really important for us to see the millions of people that have called, but also who are checking out resources and being able to hopefully know that they're stressed and that there are resources out there for them, as well as a 24/7 line for people before they get to that point of thinking that life isn't worth living.
We really are dealing with an unprecedented mental health crisis in this country right now. Some of the stats are so sobering. The Canadian Mental Health Association sent me some data recently saying that 40% of all Canadians have seen a deterioration in their mental health over COVID. And the numbers are even higher among some more vulnerable groups. It's really a struggle. And yet the Liberal government really hasn't put a ton of money into this yet, Minister. I mean, in the last election campaign, you folks promised a mental health transfer. And it hasn't come to be yet. You promised $4.5 billion over 5 years. The last budget didn't have any money in there for this. Is there a reason why you haven't started to roll that money out yet to help people who are struggling?
So, JP, in 2017, $5 billion was put into the bilateral agreements with the provinces and territories, and those provinces and territories are still receiving about $600,000 a year, and it is a ongoing commitment. We are also funding mental health innovation projects, but the money that we have put into the substance use and addiction program, helping with safe consumption sites, all of those things that happen directly from the federal government into community to help community do what they need, and then for us to be with them on the research and evaluation to make sure that those community-based programs that are working are able to be scaled up and spread across the country. So there's, I think, a great deal of work on this. We want to and will do more. Obviously, another $100 million was in the budget in the spring for the substance use and addictions program that we are going to roll out the 4.5 billion, but everybody knows it needs to be really tied to the things that are working. And we are really, really inspired by the people on the ground dealing with this crisis every day.
There was $100 million in the budget, but there was supposed to be $875 million, right? That was what the campaign document promised. That's what they said would be allocated, and it wasn't in the budget this year. Why not?
Well, I think we're continuing to roll it out as it sees fit. Certainly, the substance use and addiction program is extraordinarily popular and doing extraordinarily good work. As we've seen that with the safe consumption sites that have ramped up across the country, with 40,000 overdoses have been reversed. This is a hugely important thing, and as we move with $70 million on safe supply, so that people using drugs will have the ability to have a pharmaceutical grade medicine. That these are really important strides forward, and things that frankly are really innovative around the world.
Okay, Minister, we'll leave it there. Thanks so much for your time.
Thank you.
The 998 Suicide Prevention Hotline doesn't launch until November next year. In the meantime, anyone in mental health distress can call Talk Suicide Canada at 1-833-456-4566. There's also the Kids Help Phone at 1-800-668-6868.
Hi, Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.